the Europe's Beating Cancer Plan was eventually launched in February 2021, and in 22 the first projects started their course. There are four important pillars of the plan. One is the primary prevention, then screening, diagnosis and treatment, and finally quality. So primary prevention focuses on elimination of cancers caused by HPV, human papillomaviruses, improving health literacy, and then it focuses on lifestyles, very importantly on improving and advancing further restrictions on tobacco use, increased alcohol taxation, and reducing harmful alcohol consumption. Then, of course, importantly for cancer and for other chronic diseases, is to address unhealthy diets, obesity, and physical inactivity, which is also one of the key targets in primary prevention. In secondary prevention, in screening, the request of the plan is to ensure that by 2025, 90% of the target population in each member state is offered breast, cervical, and colorectal cancer screening. Then the European Union updated and explored expansion on the recommendations on cancer screening. They were adopted at the end of 2022. Now they added screening for prostate, lung, and gastric cancer, with the remark that each member state needs to evaluate their own situation before actually embarking on a nationwide, population-wide screening program. Yes, then of course, finally, the last point related to screening is to update the European Cancer Information System. In diagnostics and treatment, we have the setup of the EU network of national comprehensive cancer centers. We have the launch of Cancer Diagnostic and Treatment for All initiative, the launch of uncan.eu, an initiative to help identify individuals at high risk from common cancers. Then there will be a special interspecialty training program for all the three big branches of in cancer care: oncology, surgery, and radiology. Finally, quality will focus on the setup of a cancer survivor smart card, the setup of the virtual European Cancer Patient Digital Center, and finally, support cancer survivors for a fair access to financial services. An important focus of the Europe's Beating Cancer Plan are inequalities. The Commission established a Cancer Inequalities Registry. They will then monitor and follow up on the trends on the inequalities between member states and regions. It is a way of strengthening and integrating telemedicine and remote monitoring in health and care systems, improving the overall resilience, accessibility, and effectiveness of European health systems, and finally, to mainstream equality action in other areas addressed by the plan. There is a special minor focus, but a very important one in the Europe's Beating Cancer Plan, and that is to in helping children with cancer initiative, and then the establishment of a EU network of youth cancer survivors, and finally to launch a childhood cancers and cancers in adolescents and young adults initiative, so as to increase the understanding of pediatric cancers. This is all going to happen in the next couple of years. So this much would be on the implementation of the Europe's Beating Cancer Plan.